Okay, so in this video, we'll be taking a look at the EPI schedule of vaccination. So, what are the vaccines that are given soon after birth? These include BCG vaccine, oral polio vaccine 0, and hepatitis B vaccine. Then, at 6 weeks of age, the following 4 vaccines are given: pentavalent 1, OPV 1, rotavirus 1, and pneumococcal 1. Then, at 10 months of age, again 4 vaccines are given: pentavalent 2, OPV 2, rotavirus 2, and pneumococcal 2. Then at 14 weeks of age, further 4 vaccines are given: pentavalent 3, OPV 3, IPV 1, and pneumococcal 3. Then after 9 months of age, following 3 vaccines are given: MR1, IPV 2, typhoid, these 3. And then after 15 months of age, MR2 vaccine is given. So this is the EPI schedule. And it includes vaccines that are given soon after birth, at 6 weeks, at 10 weeks, at 14 weeks, and after 9 months of age, and after 15 months of age. There are also certain newly added vaccines. These include hepatitis B vaccine and typhoid vaccine IM. So these are also important. And then there are certain non-EPI vaccines which should be given to children, and these include cholera vaccine, rabies vaccine, and Japanese encephalitis vaccine. So these are the important points regarding EPI schedule. Then if a child has missed vaccination schedule or the usual vaccination sequence, then how will we do the catch-up vaccination? This is also important. So catch-up vaccination plan is followed in children which are less than 5 years of age who got no vaccine in infancy. And in this vaccination plan, what we do is, first of all, we give a BCG vaccine once on reporting, and then we give DT or diphtheria, tetanus vaccine, and polio drops. We give these 2 vaccines at 2 doses at 6 weeks interval, and first booster will be given at 6 months later. So, and then MMR vaccine will be given once to the patient. So BCG, diphtheria, tetanus, polio drops, and MMR once. So this will be the catch-up vaccination plan in a child which is less than 5 years of age and who has gotten no vaccine in infancy. So what will be the schedule of a 2-month-old baby? First of all, a 2-month-old baby will give the BCG vaccine and the 6-week vaccinations which we discussed previously, which included pentavalent 1, OPV 1, rotavirus 1, and pneumococcal 1. And then we will continue normally onwards. That is the usual sequence of EPI. Okay, then important vaccine sequence that I wanted you to know, it's the tetanus vaccine. And if the child has been infected with tetanus, then we need to give immunoglobulins against tetanus. And the dose for tetanus immunoglobulins is 3000 to 6000 international unit. And the dose for tetanus vaccine is IM dose, IM route. And the vaccination schedule for you can say active vaccination against tetanus will include dose 1 after contact. For example, if the child has suffered a dirty wound, so after that 1 dose will be given after contact, and the second dose will be given 6 to 8 weeks after first dose. Third dose will be given 6 to 12 weeks after second dose. Fourth dose will be given 5 years after third dose, and fifth dose will be given 10 years after fourth dose. So this will be the vaccination schedule of the active vaccination if the child has suffered contact with tetanus. And the passive vaccination will be done with the help of immunoglobulins, and 3000 to 6000 international unit will be given to the child. So these were some of the important points about vaccination schedule. Thank you so much for watching.